Hello, everybody. Thank you for joining our series of systemic sclerosis educational videos today. We are going to talk in detail about the disease and its progress. I'm Dr. Maggie Larché. I'm a professor of medicine at McMaster University, and I'm delighted to thank our sponsors, the Hamilton Scleroderma Group, Scleroderma Canada, and Merck. We're going to do a series of 6 short videos. Firstly, talking about what is scleroderma and giving you an idea of the disease. Then we're going to move on to the blood tests and other investigations and how you can interpret some of those. Next, we'll look at some of the symptoms, such as Raynauds, and what to do about the cold white fingers that you can get. Then we'll look at lung involvement and how that can affect some patients. We'll also look at gastrointestinal involvement. And finally, we'll look at the kidneys and how they can be affected by scleroderma or systemic sclerosis. The first video is really talking about what is scleroderma or systemic sclerosis, what causes it, what does living with it look like, what to expect, and what should you look for, and what could you do for yourself. As I said, systemic sclerosis is also colloquially known as scleroderma, or thick, tight skin. And that was the hallmark of this disease. It's an autoimmune disease where your immune system is attacking itself and causes problems in various organs throughout the body. Like many autoimmune diseases, it's a chronic, lifelong disease. And we have good treatments for some of the aspects of it, but we don't have a cure yet. Inflammation caused by the immune system dysregulation will impact blood vessels, causing what we call a vasculopathy. It causes scarring in the tissues, and that's why you get the thick, tight skin. And it, as I explained earlier, also causes an altered immune system. We don't know why this happens. It's usually nothing that the patient has done to get this disease, although in some patients there is an environmental trigger. There's a crazy immune dysregulation going on, and this image on this slide shows you that there's this big fight amongst all the immune cells. And what we don't really know is which cell is the troublemaker, which one to take out. But we know that many of them are involved, and some of our treatments will attack individual of those cells or those pathways. There are many, many aspects of scleroderma, and you're not going to get all of these symptoms in one patient. And I've just listed them here in this slide to show you the breadth of symptoms that patients can get. But don't worry, most patients don't get all of these, and some just get a handful. What does living with it look like, and how can you help yourself? The common symptoms, 8 or 9 out of 10 patients get cold white fingers, and another video will discuss that. You can keep your hands warm, you can keep your body warm, you can use a steering wheel heater, for example. So people can get ulcers on their fingertips, and those can be treated with the same types of self-help techniques. Other aspects may need medical intervention. So there are many aspects of this disease that you can do some things to help yourself, but you need a doctor alongside you to help. And in terms of specific examples of what you can do to help yourself, you really do need to give up smoking. That's number one. There are several reasons for that. It makes Raynauds worse, it makes digital ulcers worse, and it can make the lungs a lot worse. So give up smoking, keep you and your hands warm. Raise the head of your bed, just 4 to 6 inches. You just need a brick or a 2x4 under your headboard of your bed to get your bed up a little bit. And that keeps your mouth higher than your stomach, so there's less chance of reflux. Try to eat small meals regularly. Try not to eat late at night. Try to eat healthily. Nap if you're tired. Lots of patients don't give themselves permission to have a nap, but you should nap if you're tired. And get support from your family and friends. And educate yourself with videos like this. And at the end of these videos, and through the Hamilton Scleroderma Group and Scleroderma Canada, we've got educational resources as well. So that's the end of this video. We'll move on to the next one.